Okay, let's dive in. Sometimes you hear about these really sudden, quite scary injuries.
Hmm.
Maybe someone you know, like a cyclist in an accident, or even just a really bad fall, and you immediately think, gosh, is there going to be lasting damage?
Absolutely. That's always the first concern, isn't it? Especially with really severe trauma.
Exactly. And for those kinds of injuries, specifically things like uh, crush injuries, there's this therapy that maybe not everyone's heard of, hyperbaric oxygen therapy, or HBOT.
That's right. And for this deep dive, we're zoning in on how HBOT is used for what we call acute traumatic ischemias.
Ischemia. So that's when blood flow gets cut off suddenly.
Precisely. Think of a physical blockage stopping that vital blood supply.
Yeah.
Like you said, crush injuries are a classic example, or compartment syndrome, where swelling gets dangerously high.
It almost sounds a bit like something from a sci-fi movie, breathing pure oxygen in a pressurized room.
It does have that feel.
Ah.
But the science is pretty well established now.
So our goal today is really to unpack what this therapy actually does in those urgent situations and, the why behind it. Why can it help?
And we're drawing on scientific handbooks and European guidelines to make sure we get a clear picture. It's important to understand the basis for it.
Good. So starting with the problem itself, these acute traumatic ischemias, what's happening in the body, say, with a crush injury?
Well, imagine sustained pressure just physically squeezing blood vessels shut. Or in compartment syndrome, you get swelling inside a muscle group confined by tissue, and that swelling builds pressure.
And it squeezes the vessels from the inside.
Exactly. Either way, blood can't get through properly. And the big problem there is lack of oxygen getting to the tissues.
Right. No oxygen, big trouble for the cells.
Big trouble and fast. Tissue damage can happen incredibly quickly when it's starved of oxygen. In these kinds of injuries, time is absolutely critical.
Okay, so the normal oxygen delivery system, the blood, is basically compromised. Tissues aren't getting what they need. So how does hyperbaric oxygen therapy step in? It's not just a standard oxygen mask, right?
No, not at all. The core idea is to massively increase the amount of oxygen that dissolves directly into your bloodstream.
How does that work?
So normally, the air we breathe is only about 21% oxygen. In an HBOT chamber, you're breathing 100% pure oxygen.
Okay.
And the pressure inside that chamber is increased, usually to about 1.5 to 2 times normal air pressure at sea level. Sometimes a bit more, but that's typical.
So pure oxygen plus higher pressure. What does the pressure do?
Well, think about how oxygen usually travels. Most of it grabs onto hemoglobin in your red blood cells.
Right, like passengers on a bus.
Good analogy.
Mm.
But there's always a tiny bit that just dissolves directly into the liquid part of your blood, the plasma, and other body fluids. Henry's law in physics tells us that the amount of gas that dissolves in a liquid is proportional to the pressure of that gas above the liquid.
Okay, so you increase the pressure.
And you force much, much more oxygen to dissolve directly into the plasma. It's like you're creating this huge pool of dissolved oxygen floating free in your system, independent of the red blood cells.
I see. So even if the red blood cells can't get through because the roads, the blood vessels are blocked or squeezed.
This extra dissolved oxygen in the plasma can still seep through and reach those oxygen-starved tissues. It can travel further into the tissues just by diffusion.
That makes a lot of sense. It's like a backup delivery system.
Essentially, yes. We're talking a significant boost. Under normal conditions, very little oxygen is dissolved. Under HBOT conditions, you can increase that dissolved amount maybe tenfold or even more.
Wow. Okay, so that's the fundamental principle. How does this specifically help someone with, say, a badly crushed arm or leg?
The number one benefit, the most immediate one, is just getting more oxygen to those dying tissues. It's a lifeline.
Buying time, basically.
Exactly. Even if blood flow is severely restricted, this dissolved oxygen diffusing into the area can keep cells alive that would otherwise die off pretty quickly. It gives surgeons more time, maybe, to repair vessels or relieve pressure.
Okay, direct oxygen delivery. What else? Does it help with the injury itself?
Yes, absolutely. Another really important effect, especially thinking about compartment syndrome, is reducing swelling, or edema.
How does high oxygen reduce swelling? That seems counterintuitive.
It does seem a bit odd at first, but in tissues where the blood supply regulation is still working okay, the very high oxygen levels actually cause the small blood vessels, the arterioles, to narrow slightly. It's called hyperoxic vasoconstriction.
Narrowing vessels. But don't we want more blood flow?
You do in the damaged area, but this slight narrowing happens in the less damaged surrounding tissues or in vessels that can still respond. This narrowing helps reduce the amount of fluid leaking out of the capillaries into the tissues.
Ah, so it reduces the fluid buildup that causes the swelling.
Precisely. Less fluid leaking out means less edema. And in compartment syndrome, reducing that swelling lowers the overall pressure inside the compartment.
Which then takes the pressure off the blood vessels that were being squeezed?
You got it. It helps break that vicious cycle.
Yeah.
So you get better overall perfusion eventually, even though there's this initial vasoconstriction in some areas. It's quite clever.
Okay, that makes sense. Reducing the dangerous pressure. What about the body's own response? Inflammation and things like that?
Yeah, that's another fascinating area. When blood flow returns to tissue that's been ischemic, we call that reperfusion, it can actually cause a secondary wave of damage, sort of an inflammatory burst.
Right, I've heard of reperfusion injury.
Well, HBOT seems to have a beneficial effect here. There's evidence it affects certain white blood cells called neutrophils. Normally, during reperfusion, neutrophils can get activated and stick to the vessel walls, causing more inflammation and blocking small capillaries. HBOT seems to functionally inhibit certain molecules on the neutrophils, these B2 integrins, making them less likely to stick and cause trouble.
So it kind of calms down that potentially harmful inflammatory reaction.
It appears to help modulate it, yes. And there's another angle with neutrophils. In very low oxygen conditions, like in these injuries, neutrophils don't work as well at fighting bacteria. They can't engulf them effectively. That's phagocytosis.
So the body's own defenses are weakened.
They can be, yes.
Mm.
HBOT, by restoring oxygen levels, helps these neutrophils get back to doing their job properly, fighting off potential infections.
Speaking of infections, are these kinds of injuries particularly prone to them?
Extremely prone. You've got damaged tissue, often poor blood supply. It's an ideal breeding ground for bacteria.
Makes sense.
And what's particularly worrying are anaerobic bacteria, the kinds that thrive in low oxygen environments. Think things like tetanus or gas gangrene.
Nasty stuff.
Very nasty. HBOT is directly helpful here because the high oxygen levels are actually toxic to many of these anaerobic bacteria. It directly inhibits their growth and toxin production.
So it creates an environment they just can't survive in.
Pretty much. Plus, by improving the oxygen levels generally in the tissue, as we mentioned, it helps our own immune cells work better. There was a study in mice with a serious muscle infection, streptococcal myositis.
Okay.
And combining HBOT with penicillin significantly reduced mortality compared to penicillin alone. So it really boosts the effect of antibiotics in these situations.
So it fights infection directly and helps the body fight infection. That's a powerful combination.
It really is.
And what about sort of longer-term healing? Does the extra oxygen help with actually rebuilding the tissue?
Yes, although that's maybe a secondary benefit in the acute phase. The immediate goal is tissue survival. But absolutely, good oxygen supply is crucial for all stages of wound healing.
How sad.
Well, things like building collagen, the sort of scaffolding for new tissue, requires oxygen. And forming new blood vessels to restore proper circulation, that's angiogenesis, that also heavily depends on adequate oxygen levels.
So HBOT might not only save the tissue initially, but also help it heal better and faster down the line.
That's the idea. It lays the groundwork for a more robust recovery process.
Okay, this all sounds incredibly promising on paper, but what about the real-world evidence? Do studies show it actually makes a difference in patients?
Yes, there's definitely clinical evidence supporting its use. For instance, researchers have looked directly at the microcirculation, the tiniest blood vessels in animal models of ischemic muscle injury and reperfusion. And they've observed positive effects from HBOT, showing it helps maintain the integrity and function of those small vessels during that critical reperfusion period.
That's important. What about human studies?
There's a well-known retrospective study looking at patients with necrotizing fasciitis. That's a really severe, fast-spreading soft tissue infection, often involving ischemia.
The flesh-eating bacteria thing.
That's the one, yes. Terrible infection. This study found that adding HBOT to the standard treatment of surgery and antibiotics significantly reduced mortality.
Wow. Reduce the death rate.
Significantly. And interestingly, the patients who received HBOT in that study were, on average, sicker to begin with. So it suggests a really powerful adjunctive effect.
That's very compelling evidence. What about those crush injuries we started with? Saving limbs.
There are certainly many case reports and some series documenting limbs being saved. Situations where, after initial surgery to fix bones and maybe some vessels, the limb is still looking really borderline. Dusky, poor perfusion, maybe amputation seems
For
likely.
a really desperate situation.
Exactly. And in some of those cases, adding a course of HBOT has turned things around. It's helped improve the oxygenation enough to keep the tissues viable, reduce the need for further debridement, maybe allow skin grafts to take, and ultimately avoid an amputation.
That's incredible. The difference between keeping a limb and losing it is just life-changing.
Absolutely monumental for the patient. These cases really highlight the potential impact in severe trauma.
Now, we touched on the pressurized chamber. Are there safety things to consider? Putting someone in a high-pressure, pure oxygen environment sounds like it needs careful handling.
Oh, absolutely. Safety is paramount. These clinical hyperbaric chambers are serious medical installations.
Right.
They have dedicated oxygen supplies, often large liquid oxygen tanks or banks of high-pressure cylinders. And because you're dealing with 100% oxygen under pressure, fire risk is the #1 safety concern.
I can imagine.
So, strict protocols are in place. No flammable materials, no sources of ignition. Patients wear special cotton garments. And the chambers themselves, especially multi-place ones that can treat several people,
Yeah.
they have built-in fire suppression systems, often using water because that's generally the safest and most effective agent in that specific environment.
Okay, so fire safety is meticulously managed. What about medical equipment needed inside the chamber, like IV pumps or monitors?
Yeah. That's another critical point. Any device used inside the chamber has to be specifically tested and approved for hyperbaric use.
Why is that?
Well, the pressure can affect how things work. Electronics might behave differently. Plastics could be compressed. Sealed components could be an issue. So everything needs to be certified as safe and functional under those specific pressure and oxygen conditions.
Makes sense. It's a very controlled environment.
Extremely controlled. Patient safety is the absolute priority.
Okay, so let's just quickly recap the main points for someone dealing with, say, a severe crush injury or compartment syndrome. HBOT sounds like it offers quite a package of benefits.
It really does. First, that crucial direct delivery of oxygen into tissues, even with poor blood flow.
Right, the backup supply.
Then, reducing that harmful swelling, the edema, particularly important in compartment syndrome.
By causing that vasoconstriction.
Exactly. Third, helping the body manage the inflammatory response and fight off infection, both by hindering bad bacteria and boosting our own immune cells.
Tackling infection from both sides.
And finally, supporting those longer-term healing processes like collagen formation and new blood vessel growth.
It really seems to hit the problem from multiple angles. The oxygen deficit, the swelling, the infection risk, the repair process.
Precisely. It's that combination of effects that likely makes it so valuable in these really challenging injuries.
Well, I have to say, this has been really illuminating. I hope for you, our listener, this deep dive has clarified how this perhaps lesser-known therapy can be such a critical tool. It's certainly given me a much better appreciation for it.
Me too. And it does make you think, doesn't it?
Yep.
It leads to an interesting question to ponder.
Go on.
Given how potentially powerful HBOT is in these acute, time-sensitive situations, what do you think are the biggest hurdles or maybe the key factors in actually getting this therapy to the patients who need it, when they need it, within that busy, high-pressure emergency and trauma system?
That's a really good question. Logistics, availability, recognizing the need quickly. Lots to consider there. Definitely food for thought. If you are interested in digging deeper into this, we absolutely encourage you to look into the scientific literature and the clinical guidelines on hyperbaric oxygen therapy.
There's a lot more detail out there.
For sure. Thanks so much for joining us for this deep dive.